right, I think a few more folks are joining, but we'll go ahead and get started since we only have an hour. We have a number of presenters who are going to share what they're working on. We want to make sure there's enough time for both those presenters to share and to allow some time for some robust peer sharing at the other side of that. So again, good afternoon and welcome. Thanks to everyone for joining us today for our SAHF and NeighborWorks Peer Exchange. I'm Alexandra Nassau-Brownstone. I'm Director of Resident Outcomes and Cores for Stewards of Affordable Housing for the Future, or SAHF. Before we get going, I want to do sort of the standard webinar housekeeping. There are quite a few of you on today's call, so when you've connected, you've automatically been muted. We are asking everyone to use the chat box section in the GoToWebinar panel as a way to communicate with one another and with the panelists. The questions box comes directly to the panelists, but we want to make this a lot more, using the virtual platform to try to encourage greater peer exchange and sharing so things don't get lost and only come to the presenters and panelists. So please use the chat function. We have 3 presenters today. We're going to allow some time, a few minutes after each presenter, for some questions. You can use the chat function. There's also the raise your hand function. We encourage you to use that. We can go ahead and then unmute you individually. And then at the very end, when we have time for more peer exchange, please, again, you can use the chat function, but please go ahead and use that raise the hand function so that you can ask a question or share what your organizations are working on and thinking about. So I've already introduced myself, but again, I'm Alexandra Nassau-Brownstone. We are co-hosting this webinar along with NeighborWorks America. I'm joined by my colleague, Sandra Serna, who's the Vice President of Health and Housing at SAHF, and Claire, who's Director of Real Estate Programs for NeighborWorks. Claire, did you want to say just a couple words? Welcome.
Sure, thank you. Welcome, everyone. We're excited to continue to offer this webinar series. Is probably what it's going to end up feeling like with SAHF as we continue to see how we are in our shared networks responding to the COVID crises and all that it presents us in our resident services programming. So thank you for joining us today. Keep a lookout for resources that come out from this and for ongoing webinar opportunities in the future.
Great. Thanks, Claire. And then I wanted to turn it over to Sandra, who's going to offer just a few comments and framing thoughts before we turn it over and get more into the peer exchange.
Great. Thank you, Alexandra, and welcome everyone for taking time out of this very important public health crisis that we're all going through to listen and exchange your ideas. The notion of connecting older adults and our older residences in our properties is very important to say, whether it's advocating for technology solutions and options that give those individuals the ability to stay connected to their communities and their families, or just when we think about how we design our properties and create operational plans that allow residents to comfortably age in place with dignity and with as much independence as possible. So this is a really important issue to us. We know that social isolation and loneliness are conditions that have a lot of poor health and mental health outcomes. Some say with the equivalent of smoking, heavy smoking. So it's something we need to be in mind, top of mind, to make sure that while we do everything we can in our power to adhere to public health guidance during this event, making sure that we're balancing that, protecting our residents by providing opportunities to mitigate isolation. And so I'm sure you're going to hear from our panelists some amazing ideas. And I think the thread that weaves all of them together is the innovation and the agility that you're going to hear, making the most of what you have. Sometimes the best solutions aren't necessarily the most high tech. And it's all about being creative and adapting to the situation. So with that being said, I'm more than happy to pass it on to Alexander, who's going to introduce our esteemed panelists.
Thanks, Sandra. And before we introduce everyone, we have one quick question poll for you all to get everybody engaged. We're wondering, how is your organization continuing to provide resident services staffing right now throughout COVID-19. Sarah should be launching a poll that should appear for you. Are you using 100% on-site staffing? Have you moved to 100% virtual? Or is it really a combination for you right now? So hopefully that poll has opened up for everyone. We'll give everyone a minute. And Sarah, I will leave it to your discretion to close the poll. Okay. Sarah, can you share the results?
They should be shared currently.
Okay.
It looks like, if you can't see it, it's 60% RSCs are working both remotely and on-site, 33% RSCs are working remotely 100% of the time, and 4% RSCs are working on-site 100% of the time.
Great. Thank you. And thanks everyone for participating. So now I want to move quickly over to our presenters. I'd like to introduce, we have 3 folks who are going to talk with you today. Layla Wynn serves as the Director for Housing Quality and Education for Volunteers of America. Natalie Baker serves as the Vice President for Resident Services at St. Mary Development Corporation. And Tara Wenger serves as the Director of Support Services at National Church Residences. We've asked each of our presenters to share what changes or adaptations their organization has made to their staffing models in response to COVID-19, and in particular, to reflect on how these changes reflect the needs of seniors and what are the strategies that they're implementing to continue supporting seniors. And 2, to reflect on any changes to program models, the delivery of programs, the communication strategies their staff are using with seniors. In addition, each presenter is going to reflect on a few additional strategies or topics that came up during our conversations with each of them during our prep call. So to start, I'm going to turn it over to Layla Wynn from Volunteers of America, who's been part of the team that's spearheading their COVID response across the organization. She's going to reference a response plan, which we've also provided as a handout today. So you should all be able to access that in the control panel. Layla?
All right, well, thank you, Alexandra and SAHF, for inviting me on this call here today. Again, my name is Layla Wynn, Director of Housing Quality and Education at VOA National Services. I want to open and just admit to you guys, I was not the first pick. Natasha Ofosu, our Director of Service Coordination, was supposed to join us today, but I was gladly able to take her place on today's call, share a little bit about what we're doing at VOA, and share some of the great information and resources and work that's being done through our service coordination department at VOA. So thank you all for joining us, and thank you, Alexandra, for inviting me here today. Go to the next slide.
Thrilled to have you.
You can click on next slide. Thank you. So I just wanted to go over our roadmap. I'll try to make it quick. Again, I see we have such lovely presenters lined up to speak. I wanted to cover a few topics that came out my discussion with Alexandra, the first being the housing response plan and how that was developed. Again, as you all know, the outbreak of COVID-19 intensified dramatically in early March, and a lot of us were scrambling for guidance and resources, and I just wanted to share a little bit about how we developed our plan. Second, the plan implementation. What features do the plan possess? How did we divvy up job duties and roles? What changes may have happened as we thought our plan through when it came to implementation? Third, social isolation prevention. What techniques are we using at our senior properties and all of our properties to prevent the negative health effects that Sandra spoke of earlier? And last, lessons learned. What are we seeing from our response plan so far? How are our service service coordinators engaging our residents, and just overall, how are we coping with what's going on right now? All right, so I'll go ahead and get started. Next slide, please. I'll talk a little bit about mapping it out and what that meant for us when it came to collaboration. Luckily, VOA also has a healthcare service line along with our housing. So we have a whole separate service line that offers assisted living and other healthcare opportunities and facilities for seniors as well. So we were able to tap into that expertise when we started to think about how do we put together a plan that works. How do we put together a plan that lacked some support from HUD and other things that had not been released at the time? We had a group within our organization that worked in healthcare that had some of those regulations and systems in place that we were able to adopt on the housing side. So we were a little bit ahead of the game with having that information already and trying to incorporate it into our housing operations. Second, our housing operations cross-departmental input. We basically had a series of meetings, about 3 meetings, and we sat down with our asset management department, our compliance department, service coordination, and my department with training, and we talked about what are the impacts that are going to happen if there's an outbreak at the property. What preventative measures should we put in place? We went over scenarios, and we tried to organize our information based on the level of threat that COVID-19 presented to our staff and residents. In addition to that internal collaboration, we seek the guidance of the CDC. The CDC was continually putting out updated information. We tried to keep up with whatever they were releasing and incorporating some of those guidelines into what we were writing into our plan. We also seeked out HUD. Although their initial response wasn't as in-depth, we did try to acquire as much information and incorporate that into our plan as well. We also took some information from Leading Age that was doing a lot of data gathering amongst all the different partnerships in housing and sending out updates and responses to what was occurring. And last but not least, Natasha worked really closely with some of our partners within the service coordination community, and then also asked to see if they could provide any resources for us as we put our plan together. So again, this was a huge collaborative effort of pulling together of so many different resources and information, and then we grouped it in a way that we felt worked for us and the diverse portfolio that we have at Volunteers of America. All right, next slide. All right, so just I want to talk a little bit about the framework and how we came about after we got all that great information. How did we put it into an actual plan? The first thing I want to cover is our housing response plan. It is attached. And with our housing response plan, it's a tool that we wanted to provide where if something happened at the property or whatever level, and I'll get into what I mean by level, the property is at, they have a easy to read tool that they can open up and use immediately. Again, this plan has been out for approximately, we're going on a month by the end of this week, and we're getting some great feedback from what we're seeing out in the field. So we developed the actual policy tool as the response plan. We also developed a resource list, and there's a screenshot of it to the left there. And what we did with the resource list is we included all the information we thought our staff would need to get to the residents, to post signage, all the CDC information, our screening tool for visitors, all the information that we thought could benefit our service coordinators, our management staff, when they were at the properties and needing those resources. We put them all in one toolkit, and they're easily accessible to them whenever they need it. Another component of our response plan is the critical response team. And this is where our rapid response aspect comes in. So if we are, according to the plan, if you look at levels 3 or 4, and again, I'll get to that in a bit, level 3 is just when you have a symptomatic case at the property, and level 4 is when you have a COVID positive case. And the critical response team reacts in a time frame that is totally different than how we're used to engaging with decision makers. As you all know, the hierarchy in the organization, if you need a decision from someone on a certain level as a VP or director, depending on how it's set up, it might take 24 hours to get a response or more. With the critical response team, it triages all those decision makers on one call within 30 minutes to an hour of being notified that there's an issue at the property. Once these people are on the call, we support our staff, we support the property management and service coordination staff. We talk about everything from are these areas being sanitized, make sure we're contacting the local health departments, what needs they have at the property that are critical, and then also other operational and legal things that come into play when it comes to this type of engagement at the property. We've seen some great outcomes from the critical response team. We have mitigated several instances of COVID positive and symptomatic cases where we haven't seen those numbers grow in properties. So far, we have 15 properties that have residents that have shared with us that they have a COVID positive test result, but only one property has multiple residents that there may have been some transmission. And again, our portfolio is a variety of senior affordable housing, rural development, and also family and tax credit properties. So to have such a vast portfolio, and we're seeing that this plan is working and having access to these people so quickly is really benefiting us as we go forward. Another thing that we're doing is ongoing technical support. So even once we get in there, we have these conversations, we have our action steps, we have our service coordinators engaging our residents. They're doing wellness calls. I'll get to that in a little bit of what that means. We're also providing that ongoing technical support when it comes to how that property elevates up a level or de-escalates down a level based on the risk of spread at the property. Last but not least, we have formed a resident engagement team. Our service coordinators have been extremely collaborative, and what we're doing with this team is we're taking all these great examples that we're starting to see, and we're retrofitting them in a way where multiple properties can use them. And we're even using these lists that we're collecting to share with funders or potential donors who may donate money to make sure we can provide the supplies and resources to share this information or share these projects with multiple properties throughout our portfolio. Next slide, please. All right, so I spoke a little bit about our levels and what that means. So the levels are broken down into 4 different levels. And what we did in these different levels is ask ourselves, how much at risk is this property for an outbreak of COVID-19? So our level 1 and 2 focus on prevention. And with prevention, we are, in this case, trying to prevent COVID from entering our property through droplets, people tracking it in, visitors, maintenance, all these different things that come into play when it comes to bodies moving in and out of a property. So right now, all of our properties as a baseline are at level 2. And at level 2, what we're asking people to do and some of the things we're doing when it comes to changes in how staffing is occurring is that a lot of them have transitioned into what we call flex scheduling. So funny that you had that question in the beginning about how service coordinators are working. We do have a flex schedule in place where some are actually there full time, some are not, and some are staggering coming in to keep that social distance based on the office space and the logistics that are involved. When we get to level 3 and level 4, if you check out the response plan, on levels 1 and 2, we break it down by job title. We focus on the management, maintenance, and service coordination, and we give specific details about their role during the crisis and how the plan works. When we get to level 3 and 4, we bring them all together. We don't break them out because it shows the importance of everyone working as a team and the all hands on deck approach we wanted when there's a symptomatic case, and then there's a COVID positive case. Some things I did want to mention that we are doing in these instances is that we're coordinating with management, especially our service coordinators, to combat bullying. We are starting to see that in some instances where xenophobia is coming into play. Certain residents may be getting targeted because of their background, and we're making sure our service coordinators are assisting and communicating the facts about the virus and why it's spreading, and lessening some of the fear around what this really is. Some of the other things that we're seeing is we put together a social isolation protocol at each of the properties. Our service coordinators were responsible for developing that plan and collaborating with our management staff. And in doing so, we're finding some awesome things that are happening at the property level. Just to move forward with that, if you check out this picture here, this is one of our service coordinators. And what she does is stretching and wellness activities with residents at our senior property. So she has her little boombox, and she goes to each of the different conjoined units, and she does stretching with the residents. She's keeping that social distance. She's still engaging with them. The Meadows is the property we're referring to in North Carolina, and they're doing a phenomenal job at the property. And actually, this is one of the properties that had a symptomatic case, and they're still finding very creative ways to engage residents. One thing that we have implemented is something we call wellness calls. So if you have a property that either has a symptomatic resident or a COVID positive resident, we're encouraging our service coordinators to conduct wellness calls with residents. And we emphasize that the language has to do with the wellness and the care, and not us interrogating them of whether they have COVID or not. So the calls have more to do with, how are you feeling? How are you doing? Is there anything we can assist you with? Are there any resources you need? And our service coordinators are using this information from these calls to bridge local resources and even resources we have within our organization to assist our seniors. Another thing we're doing is we're trying to maximize technology. Some things that are happening that we're seeing is that people are embracing technology. We have several different programs that are online where you can print out puzzles or do puzzles online. We're seeing programs that have fitness classes that you can connect with online with free registration. Our service coordinators are taking this and running with it. I think initially there was some concern, how do you provide resident engagement remotely? Those two, unfortunately, did not mix, and there was some question about that. However, we're finding some really cool ways that we're seeing our service coordinators be creative and get out there and figure it out. Another thing that we're seeing is fun while social distancing. As you see in this picture, there's the stretching and all that, but we've seen some ideas where we've had bingo happen where residents are in their unit and a management staff person is in the hallway and they're calling out the numbers. They're still social distance, but they're still getting their bingo games, and they don't feel so deprived of interaction. Some of the other cool ways is that we have an Alexa program where Alexa is engaging with our seniors. Other things that we're seeing is, in addition to the fitness, is that we are having other local resources collaborate with us when it comes to even access to food banks and meals and all these other things that are popping up in response to COVID-19 in our communities that aren't necessarily there on a regular basis. Again, our service coordinators have an exchange in which they share all of their information with each other. I can't express how much collaboration matters during this time. And we're seeing, I mean, so much great information being shared across our service coordinators on a national scale. And go ahead to the next one, please. Thank you. Last but not least, I want to quickly share some lessons learned that we're seeing throughout our portfolio. What we're realizing is that our staff are really superheroes. I cannot express enough how we're on these calls with our management staff, our service coordinators, and they have their own personal worries. They're worried about their safety. They're worried about their health and their family. And here we are having conversations about how do we protect the residents. And there's so much selflessness and compassion they have at the property level and for our seniors. And we're realizing that although they haven't really interpreted what they do as something that is above and beyond, this crisis is bringing that out of all of us, even in our conversations, even in the resources that we're trying to allot to make sure they can maximize their potential at the property. They're everyday superheroes. In some ways in which we're celebrating them is creating something called hero pay. And one of our affiliates has created something called hero pay, where there's an additional cost being added per staff person. I think it's a $3 hourly bump for anybody who has to work and report to the property physically. So although we have some that are remote, those who have to physically go in are being rewarded in that way through our hero pay program for one of our management agents. So we're seeing these people go above and beyond. Our initial fear is that we would see a loss in staff. We would see people not reporting to duty, but we are not seeing that in our response to this, and that gives us so much hope. Seniors embracing technology is another wildly exciting thing that we are seeing. Initially, seniors only want to make phone calls. When you start to talk about, I think about my grandma, she does not want to do anything else but make a phone call. She doesn't care about Skype or FaceTime or anything else that she can do on her phone. She thinks it's obnoxious. But what we're seeing in our seniors, because they can't get out as much as they want to learn how to do these things. They want to learn how to sign in the Skype. They want to talk to their family members. And although they've probably been pestered before about it, they're actually seeking out ways to learn. So our service coordinators have been doing a phenomenal job of walking them through the basics of how to use your smartphone. What is a smartphone versus a regular phone? We're seeing this increased engagement through technology, and this is the future of how we will continue to provide services for our seniors. Also, the local and state health departments. What we're finding is there is a variety of response on that level. We have some local and state health departments who want to jump in. They partner with us. They let us use their logo on our flyers, so it kind of reinforces the message of social distancing. And we have some health departments who literally just want us to go away. They don't want to engage as much with us. They're like, thank you for calling us, but we have nothing for you. So we've seen a wide scope of response, but when we do establish those partnerships, they're becoming great relationships that we can build upon later. So we're excited about some of those, the ones that have engaged us and want to continue to engage us, and they now know that we're in a community, and they now know the population we're serving. Last but totally not least is the humanity and what's happening, and I can't express this enough. Our slogan is serving America's most vulnerable, and what we're seeing coming out of this is a renewed passion, I believe, for what our service coordinators do on a daily basis, and an embracing of change and how service coordination is being implemented. I think there was some stigma around the technology involved and the physically having to be there to be engaging, but this crisis has brought out new ways in which we can think creatively about how we deliver service coordination to the property. So that was one awesome thing that came out of where we are so far. Again, we're less than a month in of the response plan, but this is where we are at the moment. All right. Next slide. I think that's the end. I think that's it. All right. If you have any questions, my email is right there, but do we get a moment to ask, or are we under some time?
So we have a couple of questions. I'm going to hold them and okay, go and allow Natalie and Tara to share a little bit. And then I may ask all three of you to reflect on a couple of those questions.
Thank you.
All right. So thanks so much And now I'm going to turn it over to Nadalyn Baker, who's Vice President of Resident Services for St. Mary Development Corporation.
Well, and to mirror what she said, thank you guys so much for attending this. It means there's a lot of service coordinators out there really looking to try to figure out what to do in times like these. It looks like VOA is doing a whole lot of really good work. St. Mary Development, we're small but mighty. We do not have the stretch that VOA has. We're in 9 states and primarily Southwest Ohio. I'm going to go through this rather quickly because I'm trying to keep us back on time. But we are serving over 700 seniors in the Dayton metro area. So one of the questions is how we were communicating with the residents. So in the beginning, obviously, a lot of our seniors were watching a lot of news. They were seeing these cases rapidly coming, a lot of the densely populated areas. They were hearing a lot of new language that they'd never heard of before, like social distancing. This is a fairly new term. How you shouldn't allow visitors in. You know, we started to communicate through the properties and we realized rather quickly that some of the same things that were being done in Washington State are not the same things that the state of Ohio was doing. So we immediately went to our local public health department and printed out all of their flyers for the residents immediately. So they understood, you know, we're not outside your apartment, there's not chaos. We're not in that spot yet. Right now we're in prevention mode. We kind of identified and explained in layman terms what is social distancing, what an essential worker is, because this is a fairly new term too that they didn't understand. They heard they shouldn't have visitors in, so they immediately started canceling home delivered meals and their home health aides coming into their apartment, which obviously we don't want those individuals canceled. So we were able to walk through with the residents, frequently ask questions, put on the back of our local public health handout and immediately put it on their door to kind of give them the facts so that they knew exactly what was going on in their area. And of course, we want to update your telephone number. Please give our service coordinators a call. Update your telephone number so we have the latest number. We anticipated that this was coming down. We heard rumors that social distancing, the shutdown Ohio State home order was going to be happening the following week. So we wanted to make sure we had an accurate telephone number. So if we had to respond working remotely or closing the office, being in the building partially, but just making sure that we weren't congregating. Obviously, community spaces were closed off. Dealing with residents kind of one-on-one initially. We were there if they had to come in to finish paperwork or something like that, but it was more for emergencies at that point. But we wanted to make sure we had updated telephone numbers. So we actually use, and we had used it at some of our properties in the past. We were able to very quickly, once the governor did a stay-at-home order, a system called One Call Now. It's not high tech. We actually had partnered with the AARP for the Alexa devices I heard you speak about earlier. Unfortunately, we weren't able to roll it out in time, and teaching seniors to be able to use that technology while under quarantine via phone was a little bit complicated. So down the road, I think it's going to be a great tool, and it's so wonderful that you guys have been able to use that. But this is very low tech, and we were actually able to get it in all of our properties rather quickly. I have a message. Hopefully you can hear it. If you can't, one of the presenters just holler at me here. See if you can. Let's go here. Speaker.
This is your St. Mary Connect Service Coordinator
Yes.
with important updates for Twin Towers residents. Please listen carefully as you will be asked to respond to a question momentarily. It's highly recommended that face masks be worn anytime you interact with others. This is for your safety and the safety of others. Cloth face masks are available to Twin Towers residents, along with proper wear and tear instructions. When prompted, you'll press 1 for yes if you need a face mask, press 2 if you don't need a face mask. I'll then follow up with you to ensure that you get one. Also, if you need access to the Twin Towers on-site food pantry, arrangements can be made by calling 937-813-8153 and leave a message that you need to speak to Jean. I'll return your call as soon as possible. Be well and stay safe.
So the service coordinators are able to use this system to record a message that instantly, as soon as they're done and satisfied with the message, it's blasted out to all the contacts that are entered in the system. This is great in this instance to get, we have one of the residents that's making face masks. She's been able to make 70 in a week, which is pretty awesome. We were able to get out the message. A lot of people had questions. Okay, my Medicaid renewal's up. Do I need to go to the job center to get that done? And we were able to put out a one call and say, we've spoke with the job center. They postponed all food stamp and Medicaid renewals. You don't have to do anything. Don't worry about it. Normally I'm there to help you with that, but you don't have to worry about that right now. So when it comes to stuff that we wanted to get out immediately, one call now has been a godsend because you're able to say, here's the common questions I'm getting, and here's some answers immediately. If you have anything other than this, or if you'd like a face mask, there's a polling option, press 1, and I'll be sure to return your call. So we found it really beneficial. We do have some family sites. We were able to broadcast information about the unemployment website, because you know that that's going to be the #1 question that those individuals have. It's great. The families don't have a whole lot of needs generally, but being able to have the one call now allows the service coordinators to focus on keeping the senior population safe, but still getting the families the information that they need. Our service coordinators are calling each resident individually as well, just to do a wellness check, just to talk. Just to find out, hey, I know you and I last month were working on this. Did you ever get that done? So checking the notes. Sometimes it's just a check-in. Yeah, I'm doing great. Everything's fine. Some of them have reported some needs, and we've assessed the most common needs among the residents and been able to mobilize our staff that is working remotely. They're working from home until they need to be mobilized. So there are times, obviously, for food delivery and such, that they're mobilized at that point so that we can get it out. On average, in a month, we average about 160 to 170 one-on-one face-to-faces with our residents. For the month of March, and the state of Ohio didn't do a stay-at-home until about mid-month, we had about 855 one-on-one calls with the residents, whether it was answering questions or connecting to resources or doing three-way calls because they just weren't comfortable maybe going into their dentist and weren't sure how to cancel the transportation, you know, their Medicaid transportation. You do a three-way call, be able to cancel that for them with them on speaker so that they could at least learn how to do it, be able to do some of the same things we've always done via phone. So some of the biggest needs that we found in our properties is food. We have a couple properties that are located in a food desert. We have some of them, the residents are just afraid to go out. They're taking public transportation. And I mean, from a COVID-19 standpoint, being on a bus, if you have a chronic condition, is pretty scary. So food is obviously the biggest need that our residents expressed. We were actually able to partner with a local organization that we've partnered with in the past to be able to get 500 food boxes delivered to our seniors, where we had our staff mobilized. We dropped the food boxes off at their door, and we told them on one call that this was going to be coming. They didn't, obviously, you don't have to answer the door. We're going to drop the food box off at your door. We're going to knock on the door, and then we're going to walk away. That way we don't go face-to-face with the residents. Obviously, we have our protective gear on. They're able to get food access, and they're still able to peek their head out in the hallway and see that there is people checking on them. And from a distance down the hall, you can say, hi, Ms. Johnson, I'm so glad to see you're doing well. Thank you so much. Or I don't need this box of pasta. Just leave it in the hallway. We'll grab it and, you know, and make sure somebody else gets it. But it was good because a lot of the residents that are afraid to get out and go to the grocery store, it was able to give them 2 to 3 weeks of groceries. So even if it just prevents them from going out quite as much, it'll get them at least until the next month. We are going to mobilize again at the end of this month, try to get them before the first of the month to eliminate that need. Obviously, you can drop your rent check off in the rent drop box, but if this food, it might not be the things that you love to eat, but if you're a little paranoid about going out and going grocery shopping, people will settle for a box of macaroni and cheese, we've noticed. Another issue that our residents have told us that they've been fearful about is going to the doctor. Let's say you're out of blood pressure medication. Well, you don't want to go visit your primary care physician just to be able to get your blood pressure medication refilled because you potentially could be sitting in a waiting room with an individual that is sick or possibly there with COVID-19 symptoms. Obviously, nobody wants to do that. So we had heard that some of them were canceling their appointments and putting them off as long as they could, or taking the blood pressure medication every other day, were trying to ration insulin because they were a little bit paranoid. So we immediately blasted out our one call and individual conversations to explain, hey, there's home delivered pharmacy first off. Area Agency on Aging, now the requirement that you have to be homebound, being that there's a stay-at-home order, all residents are considered homebound. And I mean, I'd check with your state because that's huge. The fact that every resident's now considered homebound and could be eligible for services through them is a big deal. You might be able to get a physician to come in. But we've actually had conversation earlier this week with a federally qualified health center and told them exactly what we were dealing with. So this is the common fear that our clients are seeing. Is there any way that you can help? I know that you, the FQHCs, they're low on people coming in because everybody has that fear. They're reporting to people, right? Like they receive federal funding. They need the clients. We have the patients. How can we make this work? Obviously, the telehealth solution, I'd love to see that in the future, but we don't have the capacity to do that right now. So they're going to do telephone appointments. So if we have a client that just needs to go in to be able to get their blood pressure medication renewed, they might be able to do that over the telephone. I mean, obviously a blood pressure, they could do over the phone. An opiate, no, they're probably going to have to come in if they're getting some kind of pain medication or something that's a little bit more controlled substance. But basic medications, they're going to be able to do that over the phone through their home delivered pharmacy. So they can speak with a nurse practitioner or a clinician, talk about, I'm not having any symptoms, I'm not feeling ill, be able to get their script sent directly to them at home. So again, they don't have to leave. So that's been a really exciting outcome from our one-on-one conversations, because it's something we wouldn't have thought of. Oh, you just wait. Yeah, well, we're not on 12 medications like some of our residents are. So it's been a pretty good solution. We've also just completed a COVID-19 a one page of resources. It's a lot of the resources we're giving out on the one call, and a lot of the resources we're giving out via the individual calls. But maybe there's a resource or two that the resident didn't think to say they needed, or was too embarrassed to talk about that they needed. Or maybe there's reasonable accommodations. I mean, maybe they don't have a phone. They have a hearing impairment. They only caught half of what the service coordinator said over the telephone. Maybe they're deaf. I mean, all of these things, we want to make sure that we're covering all of the bases and that everybody's getting the material they need to stay safe while they're there. So we've been pretty busy, but yeah, we're small but mighty, I'd like to think. Lots of low time.
Thanks so much. That's great, Natalie. I'm just watching clock, so we're gonna hold on questions again and turn it over to Tara, and then I have a couple of questions if we have time that I can pose to all three of you, and then I continue to encourage folks to add questions or comments or reflections in the chat and comment box. So thanks. Tara?
Hi, everyone.
Are you unmuted?
Yep. I do want to give a little disclaimer to start. I have 4 Chihuahuas. My husband is trying to keep them quiet, but if you hear background noise, he can't stop the yap. I'm sorry. So I will try to keep it short and sweet. Suffice it to say that our organization is doing a lot of similar things in terms of how we developed our plans and those kinds of things. There are a couple areas that I have been asked to kind of focus my portion of this on, so I'll stick to more of those things. So some of the ways that we're adapting and changing, I'm going to kind of first focus on how staffing or the employment side of things looks different, and then move to how things look different for our residents. So on the employee side of things, we, just like the other organizations, are doing a lot more work over the phone. I think one thing that's a little bit different about our response is that we are still having the vast majority of our staff report to site the vast majority of the time. We are making reasonable medical accommodations if needed for people who have more, sorry, you can probably hear my dogs. So we're making more accommodations. So people who are at higher risk are able to work from home, but we're trying as much as possible to keep staff on site. We are doing more work over the phone and screening residents before any face-to-face meetings, and then doing face-to-face meetings from social distance. So still trying to practice some of those same things while keeping in mind that that more personal touch is maybe what seniors are looking for from us. We also have we've kind of adapted some of our staff who typically work in a community-based role to cover properties that wouldn't either typically have service coordinators, where there are vacancies, or where the staff is on leave for whatever reason, that they're covering those sites telephonically. We have the goal, and we should be reaching it within the next week, that every site in our portfolio, regardless of whether or not they had service coordination before, will have an assigned service coordinator. So that on the staffing side of things, that's how we're shifting how we're doing things. Very similar to VOA, we're seeing obviously that our frontline staff are superheroes, and our organization has made a significant financial commitment to kind of back that up. Every employee of our organization was provided a one-time crisis payment, which was for a full-time worker, $250. And then all field staff are having their hourly pay increased by $5 an hour, whether they're working remotely or at site or what have you. It doesn't, just any hour work, they're getting $5 an hour more, and that will go through at least the end of April. We've also implemented a lot of supports for staff. We have a hotline that it goes straight to our task force for any questions and concerns that are coming from the field. We have a chaplaincy line that our volunteer chaplains staff, that if someone wants support or prayer, they can call. We already have in place like a typical EAP program, and that program also includes telephonic mental health and physical health services. So that's always accessible to our staff. In addition, we've increased the number of support calls with groups that we have. So typically we'd have a once a month support call with our service coordinators. We're doing that 2 or 3 times a month now. Same with our other field staff. Our task force is sending out daily emails and also videos, both to make sure people stay informed, but also to highlight all the good work the field is doing, especially around combating social isolation. And then we also have compiled a kind of like a resource directory, policies, procedures, ideas. Any of that stuff is all being put into a central location so staff could easily access those things. In addition, we also have a support program for any staff and also residents, but since we're talking about staff right now, for staff that have tested positive for COVID-19, we have a support program for them that they're getting regular calls to check in with them and provide support, guidance, essentially providing service coordination to them during the time that they're dealing with a positive case. So while they're off trying to recover anything that's going on in their life as a result of that, we're there supporting them. And then when they return to work, our organization sends them flowers, which I thought was really nice. Like a little touch just to say, like, we're glad you got through it and we're excited to see you back to work. So that I thought was a really cool thing that our leaders came up with. So that's most of what we're doing for employees. In terms of how programming has changed or things from the resident perspective, we've been having staff get really creative. They've been doing, regular outreach like others have said. One of our service coordinators came up with the acronym LOVE. So when they're calling residents, they're focusing on LOVE, which is listen, offer assistance, validate, and encourage. But, obviously the word love is that's what all that adds up to. So we're focusing on love, and offering assistance would include emotional support, basic needs assistance, those sorts of things. Our field staff are super creative in how they're getting needs met, both basic needs as well as engagement needs. They're having temporary pantries set up. They're doing door-to-door delivery of groceries. They are leveraging volunteers to do meal deliveries and those sorts of things. They've done a lot of different creative, like snack or fun item delivery, just to tell residents that, don't forget we're here for you, kind of a thing. So putting stuff outside their doors. And in some of the more creative things that I wanted to highlight, some of our properties have security cameras that are kind of like a closed circuit system. So they've set up closed circuit TV channels. The staff are standing in front of the security cameras and the residents can tune in on a certain channel. to, like, they're doing bingo that way, they're doing prayer meetings that way, they're doing like holiday fun that way. So just a way to see people face to face. In the properties that's not as easy to implement, some properties have been arranging for outdoor concerts or volunteers to come outside the building to be seen. The residents could see from either balconies or windows or whatnot. One fun thing like that, one site said that all the staff of the site got those inflatable dinosaur outfits, and then they were walking around outside the building holding up like encouraging signs and just saying hello and waving to the residents and that kind of stuff. So a lot of the properties are doing that sort of thing, even if we're not seeing each other like truly face to face, trying to be visible and making it fun. Same with social distancing practices, trying to make fun signs that demonstrate how far 6 feet is, those sorts of things. Many sites have implemented resident-to-resident calling programs to have residents checking on each other and socializing over the phone. I'm trying to see if I missed anything. Oh, and most of our sites are also doing, typically weekly, they're printing out, I think someone else mentioned this as well, they're printing out information and activities, things like word searches, crosswords, Sudokus, those kinds of things, along with the latest updates about, stay-at-home orders or property policies, trying to kind of bundle them together so it's a regularly scheduled delivery and it's not just news, it's also some activities to go along with it. So that's kind of some examples in a nutshell, but really kind of echoing what has been said, that our field staff have really stepped up and leveraged the resources, whether it's kind of technology intensive or just basic paper. It's really creativity that's being leveraged and innovation that's being leveraged to just make sure our residents know that we care about them and that we want them to be safe. And I think I mentioned this before, that the positive case calling program, having people check in on residents who have positive cases as well, that's also, it's for staff and for residents. All right, well, that's my, I hope I didn't go too fast,
No,
but if there's questions, we can take them.
Thank you, Tara. That's great. So I know we only have about 7 or 8 minutes left, so I want to invite folks to either raise your hand if you want to ask a question or offer a comment or feedback. You can also use the chat function. Sarah's going to manage that for us and let us know if we have anyone who wants to speak. In the meantime, I just wanted to ask, we had a couple of questions that came through. How are you all overcoming the lack of internet for residents? I think each of you touched on this in different ways, and there are different strategies in different properties, but any sort of initial thoughts or reflections on that?
A lot of the discounted telephones for low-income individuals, some of the residents, they were, in the past 2 years, they did start issuing like a smartphone. They've just never played with them. They actually increased unlimited minutes now and free data. So it gives them the opportunity to actually play with it and learn it and see if they can use like a FaceTime or Skype feature. Our residents don't miss what they've never known. It's kind of the feedback that we've gotten. I mean, we use it every day, so we couldn't imagine not having it through this, but they've not used it. So they're not really missing it. They did freak out a little bit when they heard they'd have to apply for their stimulus checks via internet, but thankfully we've been able to talk to the residents individually and help walk them through what they need.
Any other thoughts, either from our panelists or anybody, any participants who wants to share?
We have 2 comments in the question box that say from Anne, that says they use Zoom calls and that library parking lots have internet access.
I would also say, we'll have a slide in a moment that shares this, but we had launched a COVID-19 resource page on the Corps' website. We'll share that in a minute. There is a whole section that we have dedicated to digital access resources. You know, as many of you know, there are tons of programs across the country where they're offering reduced rates and increased data, you know, lifted their data caps. There's narrative feedback, you know, that there are challenges to signing up and long waits, and there are some issues, but there has been a large response in the ISP community to try to reduce barriers. A lot of groups I've heard are looking at how they can work to sign out hotspots and do training around that as well. So another question that we had come in was, if, you know, and I think, Tara, you talked about this a lot, what are the practices or supports or training that you're providing to staff so that they can better implement self-care, both for themselves, and then how are they also then, what resources are they providing directly to residents to help them practice self-care?
I think, this is Tara. I think the main thing that we're trying to do, especially as kind of central office staff, is to really encourage and empower people to remember they're the experts on themselves. So we're giving suggestions, but it, at least from my perspective, it can be a little tone deaf to be a safe working from home person telling field staff how to take care of themselves. So we've been trying to focus a lot more time on support calls. Typically, support calls could cover a myriad of topics. We're taking a lot more time to do venting and peer exchange and get suggestions from service coordinator to service coordinator. I think we're also trying as an organization to overtly and clearly communicate that we don't expect the same level of productivity from people. So we don't expect you to be doing your normal job right now. We, for service coordinators, both from like a HUD compliance side of things and also an operations side of things, we have officially changed the role that service coordinators have, and we've said you don't need to do the normal work right now. You can focus just on basic needs, just on providing emotional support. And I think the main thing, so you don't need to be as productive. You know how to take care of yourself, and that's one of the #1 priorities. And that's part of being productive as a worker, is taking care of yourself. We use the analogy of if there's nothing in your cup, there's no way you can fill up someone else's. So fill up your cup first. And then I think just in general, trying to help people realize that there are things during this time that we can control. There's a lot that is not within our control. There's a lot going on that feels unknown, that feels scary and stressful, but there are things that we can do physically, emotionally, mentally, holistically to protect ourselves and to take care of ourselves. And we as staff can do that and model that, and then we can also suggest those things to our residents. So if I see people around me being unsafe, I can do things to keep myself safe. If I see people outside of our property not taking care of themselves, we can take care of each other. Fortunately, and I think Natalie maybe might echo this, our organizational headquarters is based in Ohio, and our state's governor and director of health have been phenomenal. They do daily press briefings. We call it wine with DeWine. And that has been, I think, a real, they've modeled really well how to talk about being in this together. And that, I think, has been really inspiring to our organization to make sure we continue to pass that to our field staff and our residents.
Great. Thank you. Anybody else have any other thoughts? Let me go back. So we're right at time. So before we say goodbye to everyone, I wanted to share this link and resource I mentioned earlier. This is a resource that I think most of you have probably already received by email, but in case you haven't had a chance to check it out, it's a COVID resource page that we developed through the Corps platform. really with the audience of resident services practitioners in mind. So it's tools that we think would be useful for frontline staff. Some of these tools have been developed by many of your organizations or are being used already. Guidance for frontline staff, actual sample household templates for assessment, various virtual tools that we've heard different staff are using across the country. We're keeping this up to date weekly. We're also asking if you have resources that you all have developed, and we're sharing this in the spirit of peer exchange, not as best practice or guidance, because we realize things are moving really quickly. Please email us, share those resources, whether you've developed them yourself or you found something external. So I just want to thank everybody for participating. Thank you to my co-host and to all the presenters today and to all of you. This has been recorded, and we will be sharing a link to it probably, if not tomorrow, early next week. And we can include a couple of the other resources that were mentioned today. So don't hesitate to reach out with any questions or further comments. And thanks again. Have a great day.